Hello everyone, now let us discuss about 2023 CPT coding guidelines for Surgery Urinary System Part 4. And in the current session, we will be discussing the CPTs in the range 53,000, 53,000 to 53,899. So currently we are going to discuss about urethra. Urethra is again divided into incision, excision, repair and manipulation. Coming to the CPT range for incision, it is 53,000 to 53,085. And coming to excision, they are in the range 53,200 to 53,275. Coming to repair CPTs, they are in the range 53,400 to 53,520. And finally coming to manipulation, they are in the range 53,600 to 53,665. Along with that, we will be discussing other procedures also. Now coming to other procedures, they are in the CPT range 53850 to 53899. Now first of all coming to incision, the first CPT is 53000. Urethrotomy. Otomy means opening. Urethrotomy or urethrostomy. External pendulous urethra. The next is 53010. Urethrotomy or ureterostomy, external perineal urethra. The next is 53020. Metotomy, cutting of meatus, except infant. When the metotomy is performed on infants, the CPT is 53025. And do not report modifier 63 in conjunction with 53025. The next CPT is 53040. Drainage of deep periurethral abscess. And for subcutaneous abscess, you need to refer 10060 and 10061. The next CPT is 53060. Drainage of Skene's gland abscess or cyst. Next is 53080. Drainage of perineal urinary extravasation uncomplicated. And if it is complicated, it is given by the CPT 53085. Now coming to excision CPTs. The first one is 53200. It deals with biopsy of urethra. The next is 53210. It deals with urethrectomy. Ectomy means surgical removal. Urethrectomy total including cystotomy female. The next is 53215. Urethrectomy total including cystotomy male. The next is 53220. Excision or fulguration of carcinoma of urethra. The next is 53230. Excision of urethral diverticulum, separate procedure, female. The next is 53235. Excision of urethral diverticulum, male. The next is 53240. Marsupialization of urethral diverticulum, male or female. The next is 53250. Excision of bulbourethral gland or Cowper's gland. The next is 53260. Excision or fulguration urethral polyp, distal urethra. If it is urethral caruncle, the CPT is 53265. If it is Keys gland, that is excision or fulguration urethral polyp. If it is Keys glands, the CPT is 53270. If it is urethral prolapse, then the CPT is 53275. Now let us see an example. A patient is a 2.5-year-old boy with metal stenosis. Patient is brought to the operating room and placed on the operating room table in a supine position. After adequate general endotracheal anesthesia was accomplished, he was prepped and draped in the usual sterile fashion. A clamp was placed just inferior ventrally to his stenotic meatus. After the dorsal penile block has been administered. Then we cut the clamped area. That is, meatectomy is performed here. And the condition is meatal stenosis. For the meatal stenosis, meatectomy is performed. Then we cut on the clamped area to allow for a widely spatulated urethral meatus. Skin edges were approximated and the patient was sent to the recovery room in good condition. So here the CPT is, and the patient is 2.5 years old. That is, he is not infant. So 53020, metotomy, cutting of meatus except infant. Now coming to repair CPTs, the first one is 43400, urethroplasty first stage for fistula, diverticulum or stricture. For example, Johansson's type. The next is 53405. Second stage, that is formation of urethra including urinary diversion. Next is 53410, urethroplasty one stage reconstruction. One stage reconstruction of male anterior urethra. The next is 53415, urethroplasty transpubic or perineal one stage for reconstruction or repair of prostatic or membranous urethra. The next is 53420, urethroplasty two-stage reconstruction or repair of prostatic or membranous urethra stage 1, first stage. The next is 53425, urethroplasty two-stage reconstruction or repair of prostatic or membranous urethra second stage. The next is 53430, urethroplasty reconstruction of female urethra. And next is 53431, urethroplasty with tubularization of posterior urethra and or lower bladder for incontinence. Urethroplasty when it is performed for the treatment of incontinence, for example Tinago or Leadbetter procedure. The next is 53440, slinge operation for correction of male urinary incontinence, for example fascia or synthetic. The next is 53442, removal or revision of slinge for male urinary incontinence. The next is 53444, insertion of tandem cuff, dual cuff. The next is 53445, insertion of inflatable urethral or bladder neck splinter, including placement of pump, reservoir and cuff. The next is 53446, removal of inflatable urethral or bladder neck splinter, including pump, reservoir and cuff. The next is 53447, removal and placement of inflatable urethral and bladder neck splinter, including pump, reservoir and cuff at the same operative session. Whenever removal and replacement is done in the same operative session, then the code is 53447. The next is 53448. Removal and replacement of inflatable urethral or bladder neck splinter, including pump, reservoir and cuff through an infected field at the same operative session, including irrigation and debridement of infected tissue. And one important point is, do not report 11042 and 11043 in addition to 53448. The next is 53449, repair of inflatable urethral or bladder neck splinter, including pump, reservoir and cuff. The next is 53450, uretherometoplasty with mucosal advancement. The next CPT is 53451, periurethral transperineal adjustable balloon continence device. Bilateral insertion including cystourethropy and imaging guidance. The next is 53452, periurethral transperineal adjustable balloon continence device, unilateral insertion. Previously it is bilateral, now it is unilateral insertion including cystourethropy and imaging guidance. The next is 53453. Periurethral transperineal adjustable balloon continence device removal. Each balloon. The next is 53454. Periurethral transperineal adjustable balloon percutaneous adjustment of that particular balloon. It is not removal. Here balloon is getting adjusted. Percutaneous adjustment of balloon, example fluid volume. And do not report 53454 in conjunction with 53451, 452 and 453. And report 53454 only once per patient encounter. The next is 53460. Uretherometoplasty with partial excision of distal urethral segment. Example, Richardson's type procedure. The next is 53500. Uretherolysis transvaginal secondary open, including cystourethroskopy. For example, post-surgical obstruction scarring. The next is 53502. Urethrography, suture of urethral wound or injury, female. Oraphy means surgical repair. Urethrography is suture of urethral wound or injury. The next is 53505. Urethrography is suture of urethral wound or injury, penile. The next is 53510. Urethrography, suture of urethral wound or injury, perineal. The next is 53515. Urethrography, suture of urethral wound or injury, prostatomembranous. The next is 53520. Closure of uretherostomy or urethrocutaneous fistula, male. And for closure of uretherovaginal fistula, you need to refer 57310. And for closure of uretherorectal fissure, see 45820 and 45825. Now let us see one more example. A 63-year-old male patient presents for insertion of an artificial inflatable urinary sphincter for urinary incontinence. A 4.5 cm cuff, 22 ml balloon and 61 to 70 mm Hg artificial inflatable urinary sphincter was inserted. Inflatable urinary sphincter was inserted. So the CPT is 53445. Insertion of inflatable urethral or bladder neck sphincter, including placement of pump, reservoir and cuff. Now coming to manipulation CPTs. For your radiological supervision and interpretation, use 74485. And the first CPT in manipulation is 53600. Dilation of urethral stricture by passage of sound or urethral dilator, male. Initial encounter. And for subsequent encounter, the CPT is 53601. For the dilation of urethral stricture by passage of sound or urethral dilator, male. Subsequent encounter, the CPT is 53601. The next is 53605. Dilation of urethral stricture or vesicle neck by passage of sound or urethral dilator, male. General or conductive anesthesia or conduction anesthesia. The next is 53620. Dilation of urethral stricture by passage of filiform and follower, male. Initial encounter. The next is 53621. Dilation of urethral stricture by passage of filiform and follower, subsequent encounter. The next is 53660. Dilation of female urethra including suppository and or instillation, initial. And next is 53661. Dilation of female urethra including suppository and or instillation, subsequent encounter. The next is 53665. Dilation of female urethra, general or conduction anesthesia. Now let us say an example. Patient is a 40-year-old female presenting for repeat urethral dilation. Repeat urethral dilation, that is, it is a subsequent encounter. For the urethral stricture using instillation of a saline solution. So the CPT is 53661, dilation of female urethra including suppository and or instillation subsequent encounter. Now coming to first CPT in the other procedures, the first one is 53850. It deals with transurethral destruction of prostate tissue by microwave thermotherapy. The next is 53852, transurethral destruction of prostate tissue by radiofrequency thermotherapy. Previously it is microwave thermotherapy, now it is radiofrequency thermotherapy. And if it is by radiofrequency generated water vapor thermotherapy, the CPT is 53854. And for transurethral ablation of malignant prostate tissue by high energy water vapor thermotherapy, including intraoperative imaging and needle guidance, use 0582T. Coming to next CPT, it is 53855. Insertion of a temporary prostatic urethral stent, including urethral measurement. And for insertion of permanent urethral stent, use 52282. The next is 53860. Transurethral radiofrequency micro remodeling of female bladder neck and proximal urethra for stress urinary incontinence. Next is 53899, which is unlisted procedure urinary system. Now let us see an example. Patient presents today for treatment of BPH, which is nothing but benign prostatic hypertrophy, and urinary retention by TUMT, that is nothing but transurethral microwave thermotherapy. Transurethral microwave thermotherapy. So the CPT is 53850. Transurethral destruction of prostatic tissue by microwave thermotherapy. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.